The next operation I'd like to spend a little time talking about and discussing is a breast reduction. Earlier I had mentioned that the difference between a breast lift and a breast reduction is that in a lift, all we're doing is taking away skin. But in a reduction, we're taking away skin and breast tissue. Now, many of my patients come in and they will have asymmetry to their breast. That is, one breast might be bigger or smaller than the other. Well, that can be readily taken care of with a breast reduction. So obviously on the larger breast, you'll take out more breast tissue. Once again, when we do a breast reduction, there's the risk of smoking and the loss of a nipple. Generally, when we do a breast reduction, we do a pedicle technique where we leave the nipple attached to the breast, and in cases of severe macromastia, we may have to put the nipple on as a graft, which can affect the sensation of the nipple. Now, my experience has been that women that have extremely large breasts have very little sensation in their nipples. We generally will decrease the size of the nipple areolar complex, so it won't be as big as it was before, so we'll make it more proportional to the new size of the breast. Again, the scarring in a breast reduction is more significant because of the fact that we're doing a greater amount of cutting, and hence there may be a situation where you will have some hypertrophic scars. Keloids can occur, particularly in black individuals, because they're more susceptible to it. So it's important to understand, if you have a family history of keloids, you need to discuss that with your surgeon, because that's very, very important. Now, one of the other things that you can see with a breast reduction is sometimes patients will come back months later and they'll feel a firm area or nodule in the breast tissue itself, and this may be a localized area of fat necrosis, because when you do a breast reduction, you're rearranging, if you will, the entire breast. So certain areas of the breast tissue, in most cases it's fatty tissue, is deprived of blood supply, so a little bit of that fat may undergo necrosis, liquefy, and then they calcify and be a mass. So sometimes we evaluate that with a mammogram, and in some cases, if there's doubt, we'll do a breast biopsy. But generally speaking, it's not uncommon to feel that, particularly if during the course of doing the breast reduction, your surgeon has done some liposuction as well.